Okay, so welcome everybody. I just wanted to introduce today our speakers for our workshop, An Inclusive Response to Mass Violence Incidents, which is going to be presented by Dr. Stacy Beers and Special Agent Brett Kalina. So I guess you can go ahead there, Stacy. Thanks for joining us today.
You're welcome. Thank you. I feel like I am back home. It's nice to be here. Some of you may remember I started my victim services career in Pennsylvania in Chester County as a volunteer, and then in the Lehigh Valley at Crime Victims Council. And so it's been a long time, so I do feel like I'm home. I've been to Pathways many, many times and was actually on the working group when it first started at PCCD. I've been in victim services for about 28 years now, and I currently work in the FBI's Victim Services Division. And, you know, when I was talking about, we were talking to Kathy Buckley about possible doing something that would really showcase diversity and inclusion. We got to talking about this, and I thought, what a great presentation to put together. Brett Kalina, who'll be joining in a minute. He is a supervisory special agent in San Diego. So it is heading to 6 a.m. his time. And him and I met when we both responded to the Pulse Nightclub shooting. And we were able to really bring a comprehensive response that was very inclusive to mass violence incidents. And so Brett has presented numerous times on his experience with the response to the Pulse Nightclub shooting. And I'm really looking forward to kind of having us bookend this presentation. So what I'd like to do is put together, share with all you a framework of how to build a victim assistance plan, kind of what it looks like, that sort of thing. And then Brett's going to kind of bring this to the end and talk about bringing this all together and marrying it into how we offer an inclusive response. So I'm going to share my screen. All right. All right. Can somebody just give me a thumbs up that somebody else let me know you can see this?
You're good, Stacy.
Great. Thank you so much. Okay. So what I want to do is just give you a framework as to kind of our role, what we do, and then move into planning and preparing for victims in the aftermath of a mass casualty. Talk a little bit about predictable challenges, but also practical solutions, why it's important to have community partnerships. And I'm sure that we all know that just working in victim services. Talk a little bit about our victim services response team, then get into some of the emergency management things. One of the things that I learned as a victim advocate is I really didn't speak the language of emergency management, and emergency managers don't really speak the language of victim services. That is critical, and I'm going to talk a little bit about some of that. I want to talk about long-term considerations related to, what we can expect long-term when it comes to working with victims of these and communities in the aftermath of these, a little bit about personal effects and some of the items that are left over from these events. And then we're going to segue into Brett's presentation. We're going to talk a little bit about the Directors Advisory Committees, what they do. And then Brett is going to close us out by doing a case study on the Pulse Nightclub shooting. Feel free to ask any questions. You can pop them in the chat and the Q&A section. And I've asked Betsy and Jeff just to shout them out because I can't see the screen when I'm presenting. So feel free to ask any questions. Some we may hold till the end, but overall, I'm happy to answer questions as we go through. So just an overview of where I currently work now. It's the Victim Services Division in the FBI. I've been there for 11 years. But this division is relatively new. If you think about the scope of victim services has been around many, many years. Our division was only established in 2001, basically after 9/11. It was a collateral duty. There were admin folks that were basically notifying victims, and that was pretty much the extent of it. After 2001 and the 9/11 attacks, the director at that time, Director Mueller, said we need to do something a little bit more comprehensive. So that is when the Victim Services Division was born. We are partially funded by VOCA funds, which probably all of you are familiar with, VOCA funds. Most of us are funded by VOCA. We're not directly funded by the FBI. And as you all know, that the funding comes through OBC. Now, people often wonder, why does the FBI get involved? So I will explain a little bit about why we get involved, what our legal mandates are. And so as we know, there are victim rights primarily in every state, and Pennsylvania has victim rights as well as many other states. The legal mandates for the federal system actually give victims in federal cases legal standing, which means literally if their rights have been violated or haven't been provided for, they are not, they can sue the government, and they have. And so saying that, there's actually teeth in these, and they come from the Attorney General guidelines of 2011. They are actually being redone right now, but this is what we have right now for the legal mandates. And so federal law mandates that, number one, the FBI has to identify victims. Certainly, it's not easy to do that. You know, we talk about the different groups of victims. We have the deceased, you have the injured, you have what we call present but not injured, and you'll see the federal definition in a minute. We really do scope it wide. But it's not good enough just to identify them. Next, we have to develop contact information. That is not easy either. Some people are really hard to get in touch with. They don't want to share their information, and that's completely understandable. But when we have an open investigation and it's an FBI legal, if it's an FBI-led case, these are when these really plug in. We have to provide information. We do the needs assessment. We try to figure out the resources, and we plug in the gaps as best we can. We walk with victims through the actual case, through the investigation. We could be providing them briefings. We could be, giving them investigative updates. And then we also have to ensure that personal effects are returned in as good as condition as possible and no longer needed for evidence. Additionally, once we have something in evidence that belongs to a person, we have to let them know that we have it in evidence. So these are just a general view of some of the federal law mandates that we have, so that when an FBI case is open, that's where we really have to plug and play, and that's when we have to make sure those victims' rights are being offered and shared with the victim. Now, there's two definitions. I'll spare you the details because, we have acronyms for everything in the government. But the basic federal definition is anyone who's suffered a direct physical, emotional, or financial harm. And if you think about it, you throw a pebble in the pond, and that really goes out wide. So when we're talking about physical, we're talking about those who've been killed, their next of kin. When it comes to children, their guardians. When you think about people who are physically harmed, you have those who are hospitalized, those who are the walking wounded, those folks who maybe never got any kind of medical treatment and left and went back to their home state. And I saw a lot of that in the aftermath of the Las Vegas shooting several years ago. And then you have this emotionally harmed. So we call these folks the present but not injured. These are the folks that were proximate. These are the folks that were there, that might have heard something or saw something. And so, when you think about this pebble in the pond and you see the ripple effects growing, it's huge. Pecuniary harm, that's the financial harm. You're talking about businesses there and things like that. So when we talk about identifying victims, this is what we're talking about. And so you may only think you have X number of victims, but when you really scope it out, it gets quite large. Now, the FBI doesn't open many investigations when it comes to mass casualty attacks. There's not many that have a federal or a terrorist nexus, thank goodness. We do get involved with a lot because a lot of our external law enforcement partners ask us for assistance. So in 2012, the Investigative Assistance for Violence Crime Act was passed by Congress, and it allows states to ask for federal assistance in the aftermath of these kind of cases. Now, what does that mean? Well, it means that when the local states are asking for assistance, they could be asking for a menu of services. So it could be SWAT, it could be our evidence response team, it could be victim assistance. And so, a lot of times we are supporting cases, but we're not the lead. So when I think about certain cases, the Las Vegas nightclub shooting, the Las Vegas shooting of the at the festival, that was not an FBI case, but you wouldn't know it because of the number of people and the resources that we spent. and that we sent out there. That was a Clark County case. So that is a very different response. Now, we still make sure that we're following our process for helping the locals identify victims, helping locals develop contact information, setting them up for success. And I'll talk a little bit about that and how we did that in Pulse. So when we think about the number one thing when we're talking about mass casualty response, even if when we create it with an inclusive lens, we need to plan and prepare. That is the number one thing. The last thing you want to be doing is developing these plans on the fly. We all know that relationships are everything. So the first thing we've been able to do is, and these are two initiatives that we're actually launching this year, is we're building what's called trauma notification teams. And so many of you may be familiar with the death notification training. We are happy to say that we partner with Penn State University to do this. This was launched in 2015, so it's 6 years old, but we are revising it this year. We're developing an app for the death notification training, and we're also uploading some videos that actually show best practices and things not to do and teaching methods. So in all 56 field offices in the FBI, we are going to be launching trauma notification teams so that we stand at the ready to support our local partners. The reason we do this is because the number one thing victims will tell you in the aftermath of a mass casualty event was how horrible their death notifications were. Now, we know on a good day, most law enforcement are not trained. The academies do not put death notification in their curriculum. And so they literally learn it like in the car on their way to do a death notification. We know that that's not best practice. And so what we're doing is setting our field offices up for success because it's generally one of the things that we get asked to do. Now, we don't do fatality management. That is not what the FBI does, but we certainly can support our partners when we do this. And so you're more than welcome to check out the website here. And it's about an hour-long training. It's got a lot of resources, and look to see some changes coming in the next few months to that platform. The second thing when we talk about planning preparedness is victim assistance plans. What we know is that when you look at, if anybody's ever seen a victim assistance plan, frankly, they're sometimes hundreds of pages. Victim services is very rarely recognized in the plans. And so what I would suggest to all of you is look at your city, your county, and your state plans and see where victim assistance is. See where you guys are represented. I will tell you in the FBI, each 56 divisions have a crisis response plan. We are a paragraph in that response plan. And after the Tribeca truck attack several years ago in New York City, New York, who is our largest field office, said, we want to actually have a plan. And so what we did was we built it out. The number one thing is identifying unique aspects of the community. Where are your marginalized populations? Where are your special populations? What are some of the geographical issues in your area? Looking also at what's the pre-trauma equilibrium in your community. So I don't have to tell anybody on this call that there are challenges between law enforcement and communities. So knowing what the pre-trauma equilibrium is in that community is really helpful. I will tell you that when I responded to the Charleston church shooting at Mother Emanuel, great group of local victim advocates, incredible folks to work with. And, we all show up with our FBI insignia on so we can be identified. But I was pulled aside by one of the victim advocates that said, hey, I don't know if you realize, but last week we had an African-American male that was shot and killed by a law enforcement officer in North Charleston. So you might want to not be so affiliated with law enforcement. And I appreciated that because a lot of times as victim advocates, we don't see ourselves as part of law enforcement. And for me, starting in a comprehensive victim services agency in a sexual assault, a rape crisis center, it was really hard for me to make that switch to law enforcement because I no longer seemed to be kind of a person that was community based, and I was more aligned with where I worked. So I appreciated that. And so I say that to say that is something that we definitely need to be aware of in a victim assistance plan. We need to know, what kind of critical incidents have happened? Have there been hurricanes with lots of displaced individuals? looking at the East Coast now with like Hurricane Sandy and everything coming up here, people are moving around. Katrina displaced a lot of people. Knowing your community is really, really key. The other thing is looking at sites for potential reunification or family assistance centers. Where are those large sites? I'm going to give you some statistics that'll help you build this in your plan. But where are those sites? And Pulse was a great example of that. And I'll share that as we get closer to the case study. Transportation hubs. Where can people easily enter your community and exit your community? Are there train stations? Are there airports? Is there a major dock? I don't think we have that in Pennsylvania, although I think we could argue that Philadelphia may be there. But where are they, and how can people get access to it? And also, when we look at sites and we look at these transportation hubs, what is the public transportation like in your community? If people have to get to your services or a family assistance center, how are they able to do that? Are there partnerships that you can have with your community in getting people bus vouchers and things like that? And then where are your trauma centers and hospitals? Where would people most likely get trained and then get treated? And then that's how you build out your plan. So what does an element of a victim assistance plan look like? First of all, your background, your scope, your concept of operations. Like, what is this plan going to do? What is your scope? Who does it impact? It would be awesome for you to develop this in concert with your Office of Emergency Management. And I'd encourage all of you, if you have not had relationships with your OEM, Office of Emergency Management, it is so critical to do that. Also, when I was in Pennsylvania, every state has a state VOAD, Volunteer Organizations Active in Disasters. And I was the representative for the Keystone Crisis Intervention Team, KKIT. And so I did a lot of work with Pennsylvania VOAD, but knowing those folks and making sure that you're with them at the table is really, really important. When I talked a little bit about your community, this is where you put it in your situation, assumptions, and demographics. Great example I have in Washington, D.C., we have a college specifically for the deaf and hard of hearing. It's Gallaudet University. That needs to be built into the Washington, D.C. Plan. Why? Because if you're coming in from out of state and you have no idea, we may need ASL. If that population is targeted, if they are victimized, we have to be ready to support them and not try to make the plane while we're flying it. The planning and preparedness piece with the plan is also the mitigation, the 4 phases. This is the FEMA 4 phases. So your mitigation, that is your relationships. The preparedness, how are you going to train? How are you going to really decide, okay, who are your vetted partners? That's another thing. Everybody comes out of the woodwork when it comes to supporting victims in the aftermath of these cases, but they need to be vetted. So this is where you build them into your preparedness. Response, what does your response look like? And your recovery, what is your long-term plan? You also need to build in here resource support, logistics management. If something goes bump in the night, who can you call? We have appendices in our planning. Our plan is about 90 pages. I will say that 60 pages are appendices. Go-bys, fact sheets, things like that. And so, again, these are just some ideas to keep in mind when you're building a plan. So what are some predictable challenges? So the first thing is victim identification. And I'm going to use Pulse as an example since we're going to be doing the case study of this. You had people out for an awesome night. It was a Saturday night. There were a lot of people in this club. A lot of people knew Pulse in that community. It was LGBT night and it was Latino night. So you had a large group of people in an area. And then the shooting happened and people just ran. So you already have a closed population. We talk about open and closed population. This is an open population because we don't know who was in there. A closed population is more like when an airline or when there's an accident. You have the manifest. God knows you can't get on a plane without a million pieces of your ID. So we generally know who's on planes. Once those people are taken to different hospitals, it then becomes an open population. So the Pulse Nightclub was an open population. This became a real challenge because we know, we certainly started to identify the deceased, although I will be honest, it took a while for all the deceased to be identified. And we heard of some of the next of kin going from hospital to hospital trying to find their loved ones. And that's agonizing when we hear that kind of thing. So Having a plan in place for victim accountability is really, really key in your plan. So you identify the victims. So we had in Pulse, we had the deceased. So then we had to identify who are their next of kin. We had the injured. We had those who were hospitalized. We had those who were there and were injured and basically went to the hospital and were released. And then we had the walking wounded, people who never went to see a doctor or went to their urgent care and didn't make themselves known. Then we had people who were there, who experienced it all by their senses, and they were the proximate victims. You scoped the perimeter and you had businesses all around Pulse. And so it really became bigger and bigger. I will tell you that setting up a family assistance center after Pulse was awesome because people from the community came and we were able to identify more victims. Now, why was that helpful? Well, because, we're talking with Florida with crime victims compensation, it afforded people an opportunity to get services. Not everybody qualified for crimes comp in Florida, but we could still plug them into services. And so the whole point of identifying victims was just to really make sure that they were recognized so that they could get services. There was a lot of private funding coming in. Setting that up was really, really key. Now, the victim response management, that is huge because you don't want to have, we don't want to have any kind of competing efforts. And so I will tell you that between the victim response management and the resource coordination, this is where the family assistance came in. So every victim specialist in the FBI has to do what's called a pre-incident checklist. And they have to update it every 6 months. This pre-incident checklist really was, it goes from soup to nuts. Who are your partners in the community? Where are your locations big enough for a family assistance center? And so one of them was hotels, but we knew that this population was so large. And so we thought, okay, where can we go for this? So there was a basketball stadium there, or court. I don't know what you call it. And I'm sorry, I don't do a lot of basketball. I'm a hockey girl. But saying that, there was this area that was large. So I literally walk over and I sit in the lobby and say, I need to talk to somebody. And I started to explain to the leadership there what we were looking for. And they said, we have a football stadium where they play the Cotton Bowl. How about we use that? And I thought, now that we'd never done before. But I will tell you this, it was on a major public transportation route. Because it was county owned, we were able to get free bus vouchers for people. We could have security there. We could have food there. It was so large that we could scale it as much as we wanted. And so that was really the key for us. And so we could control the perimeter. And so that is what we decided to do. On an average, in a mass casualty event, you can expect anywhere from 6 to 8 family members per victim to show up. In Pulse, that was doubled. And it was doubled because of the cultural perspectives of this case. Latino families, it was large. And so we had about 12 to 13 family members per victim. It was also chosen family versus biological family. So when you add the different cultural nuances to this, and we wanted to be inclusive, we knew we wanted to have a space that was very large. The other thing is, when we talked about resource coordination, every morning and every night, we would have a meeting with our victim specialists who were there. We did launch our victim services response team, and every morning we would have meetings with them and every night. One of the things I was listening for was the themes, because that helped influence who would be at the Family Assistance Center. I assisted Orlando with setting up the Family Assistance Center. They'd never done it before. And so I just kind of stepped in and helped them. And after 2 days, they kind of took it and ran. And it was really awesome to see a community kind of really take something and run with it. It was awesome. But what I will tell you is that we were hearing from victim services specialists in the field that when they were at hospitals, there were people, for example, from some certain faith communities that refused to meet with some of the victims because they were gay. We were hearing things like they wouldn't conduct last rites because a person was gay. And I was like, oh, time out. When we think about resources here, the only resources that will ever be allowed in this Family Assistance Center is resources that are, number one, vetted, and number two, are inclusive. And that is the bottom line. And so We worked with our Red Cross partners to make sure that that was the case. And so we might have started with about 18, 19 different groups of individuals and agencies that supported this family assistance, but it grew to about 25. And that was because the victims were telling us things that they needed. So saying all that, that was really, really helpful. I will tell you that all the looky-loos came out of the woodwork. I will tell you that when it comes to resource coordination, it was really challenging. We had people who showed up that wanted to do massages with victims. Well, we all know that, it's not overly appropriate for victims, to touch people we don't know without their permission. And so that was not a good look. We also had people showing up with puppies and dogs that wanted to, train their dogs with victims. And we were like, yeah, no, that's not going to happen. Communication is key when we have predictable challenges. So having our meetings, talking through some of the things, just as we met every morning and every night with our victims specialists, I also met every morning and every night with the Orlando folks and also their leadership, and then also their all the agencies to hear what they were experiencing, so we knew what we needed to do if we needed to change something. Personal effects. I never really thought about this before working a lot of mass casualties. You go, you support the victims, and you plug them into local resources. But victims have things that are important to them, items that are sentimental. Could have been the last thing a victim touched before they were killed. And so personal effects has really taken on a new meaning with the victims that we serve. And so making sure we have a plan for that. Now, what does that mean? Well, first of all, we don't throw out personal effects, even if it's got biohazard. If it's not needed for evidence, our office has a contract with a company who will come collect it, catalog it, and clean it. They will then box it up in a very nice white box with tissue paper. It is then sent back to the nearest victim specialist throughout the FBI, and then they will hand deliver it to the victims. So we have a well-oiled machine when it comes to personal effects returns. But you need to think about that when you're building your plan, because I will tell you, in the aftermath of Vegas, we had a family assistance center in the convention center, but half of the convention center was personal effects because there were thousands of personal effects. So these are some of the predictable challenges to think about when you're thinking about a mass casualty response. Now, identifying community partners, that's part of this mitigation when you think about this whole thing in your plan. These are just some folks who you may want to think about when you're working on these. Schools should be front and center. Obviously, the medical examiners, if you don't have a relationship with your medical examiner or coroner, you get one, because those folks are key. Family members have a lot of questions for them. Knowing, how victims are identified in your community. Do victim family members have to go, and do they have to view their loved one? Can they view their loved one if they want to? What does that look like? And so really looking at all your community partners is really, really important. So I just want to put this little visual up here for what this looks like. So really we want to identify the community partners. We want to do a community needs assessment. What does your community have? What is it lacking? How can you integrate into your community plan, whether that's city, state, county? And then you want to train and exercise. And I'm here to tell you that most training and exercises stop when the tactical piece is done. So, they bring in all the toys, they bring in all the guns, and then boom, the subject's been neutralized, the bad guy's been caught. And then we're done, and we wipe our hands and we walk away, and we're like, whoa, whoa, whoa. This is when victim services really plugs in. And so it's really important that we continue to make this happen. And so we do a lot of this. We talk a lot with community partners about this. I wanted to share a little bit about our VSR, Victim Services Response Team, because that is how I worked with Brett. And so VSRT back in the day was built on just victim specialists, and they were doing everything. Now we have 171 victim specialists in all 56 field offices, but you can imagine that that's not enough when we have a mass casualty event. So we started off by having a multidisciplinary team. We scoped it a little bit wider, and we included agents and analysts. The agents are the ones that really can help us in the command post, help us with personal effects. The analysts actually take all the data. When we talk about taking all that victim identification piece, that is really huge. And we can deploy anywhere in the country. We only go when we are invited. So I just wanted to make sure that you guys are aware of that. We can provide on-scene assistance to families and victims. Here are some things, death notifications, I've talked about this. We can help anything from the hospitalized victims, certainly they don't want to leave to go to a family assistance center in the aftermath of these things. And so we bring those services to those victims and their families, whether in the hospital. We support the families of the deceased individuals. We'll talk a little bit about some emergency funds that we have, but that is sometimes how we can plug some of the gaps. Our analysts help us develop and manage what we call victim lists. So we know, okay, who's got what and what does it look like? Who's working with what family and that sort of thing. I talked about the personal effects, certainly supporting family assistance centers, and then planning for and managing family briefings and site visits. So those are really key. One of the things that when I lead some of these events, I will say is, if we have all the leaders in the community that have time to go and talk to the media, then you sure as heck have time to go meet with the victims. And I've heard it once, I've heard it a million times. It's an open investigation and we're not allowed to say anything. It's like, okay, number one, you can introduce yourself. You could talk about your agency and you could talk about why your agency is involved in the investigation. You can also develop a roadmap and tell families what they can expect, and they deserve that. So when I engage with communities, when I am leading these events, whether it's an FBI-led investigation or not, I'm always driving that point home because victims really deserve to hear from those in leadership. And then site visits, certainly wanting to know, okay, can we go back to the site? We know how important that is for family members. That is a beast to manage. And so really trying to figure that piece out. So those are some of the things that our team does. Here's just a little overview of some of the, actually all of the responses to date that we have supported. We did come out to Pittsburgh in Pennsylvania in the aftermath of the Tree of Life shooting. And so we have been in Pennsylvania. And so we're happy to support again when we're invited in or when there is an FBI-led investigation. One of the things I wanted to, really kind of break it down is that victims really need a couple things. They want information. They don't want information from the media. They want it before it hits the media from an official source and as soon as it becomes available. That means if we partner up a victim specialist or a victim advocate with each family, that's how we can get our information to them. They need the basic food, water, shelter, medical care. And we all know victims have a different definition of safety and security. What makes me safe and secure may not make you safe and secure. So one of the things we know is in the aftermath of these events, when I'm thinking about Family Assistance Center, we don't need everybody in there with their weapons displayed. That may not make people feel better in the aftermath of an active shooter. And I will tell you, in the Family Assistance Center in Pulse in Orlando, we did a really great job of that. We had people that hadn't been interviewed, and so we had a completely separate area for the interviews. And a lot of our law enforcement partners, they would have a gun on their ankle. I mean, I'm certainly not going to tell law enforcement not to wear a gun. I don't have the jurisdiction to do that. What I can do, though, is sometimes we have law enforcement that literally launches right in from the street, and they might have like a T-shirt on or something that may speak to guns. Like a lot of the SWAT guys have those kind of like, that's not appropriate for a family assistance center. So we try to really scope it so that people feel safe and comfortable as they can be. So the reunification plan hotlines are a big issue. We've got 311s, we've got 211s, we've got 911s. Depending on other things, we have, 1-800-CALL-FBI. We have, 1-800-USA Rail in the aftermath of, any track event. So we've got all these hotlines. Everybody needs to have a script and everybody needs to have that one thing that they're saying so that nobody's competing with, information. We need to have a site for immediate reunification, and we need to provide those that information so people are going to one place. It is key and critical that we have victim support personnel on hand. I will tell you that, generally in the aftermath of this, we usually get local mental health folks come. Listen, I'm a clinician. I'm all about it. but people are not wanting therapy right now. They're wanting crisis intervention. And so it's okay to have people there at the Family Assistance Center so they can offer their services in the future. But, you know, we are needing people that can do crisis intervention. And we actually had a room for that in the Family Assistance Center in Orlando. After we have that reunification center, it does transition to a family assistance center. And so that's really where you want all your groups to be represented. So I don't know if anybody's ever seen a family assistance center. This is a photo of our family assistance center in Las Vegas. Obviously, there's no victims in here. We do not allow any photography in family assistance centers when victims are there. What we generally do is have the media come in before so that we can use the media to help us get the word out, because people are afraid as to what is this, what's going on, like, well, who's going to be there. So obviously this was very, very large. If you can't see it from this picture, but if you're looking to the right, on the right hand side is where all the agencies set up their tables. I think we had about 15 to 20, maybe about 15 probably in Vegas. In the back, like kind of behind that pillar, we had a children's area. I'm here to tell you, if you don't have a relationship with your local Red Cross chapter, you need to get it, because they have a contract with Church of the Brethren, who can set up a child center in a minute. All of their volunteers have checks. You don't have to worry about any of that. And so saying that, they came in, they pulled an 18-wheeler up, and it was like a daycare center back there. It was awesome. There were no walls, so parents could see and the guardians could see their children, because they didn't want to be separated from them in space. So we were able to do that. And then we had tables with different things, and little snacks, tissues, things like that. In the back behind the black draping, that's where all the personal effects were. We had private rooms back there so that we could actually go and we could share with families. We could give them the personal effects and not do it in the out here in the open. So, you know, I will tell you that every family assistance center looks a little different based on the scope of things. In Vegas, you know, the sky's the limit. They're used to doing a lot of large events there. In Orlando, we were very lucky to use that sports complex. That had never been done before. And we thought that's a really great opportunity to think about in your local area. If you ever had to set up a family assistance center, how helpful it would be. We had people who companioned, so we had family victims that would come in. They would do a very basic intake. You know, we were just trying to figure out what it was that they were looking for, what their needs were. They were partnered with a victim advocate, and then they were literally companioned through the process. And so this is what we did. And we do it every time we're asked to support a family assistance center. Now, when we think about the operations, who's involved? That's always the key. Like, who's the boss? Who's involved? Well, it doesn't matter if it's an FBI investigation or not. It's the locals. The locals operate the family assistance centers. They're the ones that are, they're going to be there when we leave. And while our local victim specialists are there, it really is the community that puts it together. So, but who manages it? Who's in charge? In Orlando, in the Pulse, in the aftermath of Pulse, you know, we set it up, you know, now the community owned it. And after, like I said, 2 days, it was awesome. They were doing all the things that we had set up. We decided on a venue because we needed the large space. So when we looked at the numbers, there was no way that we could use a hotel. It would have been overwhelming. You know, we talk about community resources. A few slides ago, when I talked about your community partners, that's who should be there. You know, you can add people as you go. Some people are more, they should be more reserved for resiliency center and maybe the long-term piece. Who provides security and access to the FAC? So is it your local law enforcement partners? Because trust me, you got the looky-loos that want to come in there. What are the typical hours of operation, and how do you get that information out to people? And how do you determine when to transition? It's usually 7 to 10 days, and then we go to a resiliency center. But the community really does dictate that. You kind of want to need to have all that information before you start to launch your family assistance center and the messaging. What does the infrastructure look like? It's away from the media. So if there needs to be media briefing, have them do it, you know, down the road. So what we did in Pulse is we had our area where victims came in. We had security. But then what we did was we had a completely separate area where we would do the press briefings. And so the mayor would go out and talk about, you know, come to the Family Assistance Center. This is what we offer. This is what we can do. These are some of the resources that are here. You want to have a large room for briefings. We had large space there to do that, and we actually did a briefing before we left. Obviously, small rooms for private matters, and I shared that with the previous slide. An intake area, and that was staffed by victim advocates as well as Red Cross disaster mental health folks. We had the area for personal effects and storage return. Facility dogs, I could do a whole presentation on facility dogs. I'm actually a handler for one of FBI's 2 crisis response canines. Our perspective is we use facility dogs with crime victims and not therapy dogs. The mass casualty response has really nailed that home for us. And so that's a whole separate presentation, but if anybody has questions about it, you're welcome to reach out to me about that. And I do know that there's some facility dogs that you all have in Pennsylvania, which you're very lucky. Childcare, again, Church of the Brethren through Red Cross can support that. You want to have EMS there, food and water. One of the things I will tell you about Pulse is they really knocked it out of the park. They would have different food. And what we saw is people were coming back over and over and over again because they needed to bring certain paperwork and things, but it was a way to commune. I've never been to a family assistance center since that has had quite the scope of needs met. I mean, they set up computers and printers and everything you can imagine. It was amazing. So here's some of our partners. This is actually Vegas. So when I said to you on the right-hand side, here's our agencies on the right-hand side. The picture on the bottom right are not victims. They are our employees that posed for photos so that we could show what this looked like. And, we don't overwhelm people. We just really, are there to assess their needs and then take them to the agencies that best fit those needs. Here's some of the long-term considerations. Certainly the Resiliency Center's OVC has grants to help set that up. I talked about the briefings and investigative updates. We did briefings to the families of Pulse, a year later, and then when the case was closed. And Brett's group was amazing because they were with us lockstep throughout the way. They had vetted, they had credibility, and so they were there and they helped guide us to provide these services to the victims. We do, as I said, memorials, anniversaries, court proceedings, that kind of thing. But again, it's really important to not just develop the relationships, but maintain them as you go forward. So after you do these mass casualty events, you definitely want to have meetings, follow-ups, exercises, what you could do better. I talked a little bit about personal effects, and this is just why we do it. I think everybody here in victim services knows how important that is. There are several types of personal effects, those that we retain as evidence, those are associated. So like your wallet, something with your name in it, but then there's a whole bunch that are unassociated. And the contractor that we use actually can set up a password protected website so that they're able to put a password, a website up, and then people can go on in the privacy of their own home, or a victim advocate can go out to their home with them and go through that catalog to kind of see what might be theirs. What we know is for an elements of a successful response, you need the right people. You want to manage and coordinate together. You want to deliver services together. You want the right plan. Start building your plan now. Don't do it in the aftermath of a mass casualty event. And you want the right focus. It's all about the victims. Anybody who's ever known me knows that that is what drives me. That is the mission. And frankly, in the Victim Services Division, that's what we do every day. And so, we want to make sure that everybody's aligned with this, and this makes it a successful response for victims. So if I haven't said it enough, relationships are critical. I never knew Brett before Pulse, but I got to tell you, now that I know Brett and I've learned about the Directors Advisory Committees, they are golden in the FBI, and we can tap into them when we're supporting a certain community. Obviously, we know that having a framework for what we do as victim advocates way in advance creates the foundation. So knowing who your emergency managers are and getting to meet them is really key. There's some predictability to mass casualty events, and that's why I went through some of those things. Every mass casualty event is unique as well, but it's definitely important to be flexible and learn from our past experiences. And what I always say to a community is, learn what we did right and learn what we did not so right. And we're going to make it better for the next community. Now, I want to talk a little bit about the Directors Advisory Committee and segue into Brett. I'll answer any questions before I segue over to Brett. But I didn't know about this until we responded to Pulse. So I was asked to set up the Family Assistance Center, and then I heard that one of the DACs, the Bureau of Quality group, would be coming, and I'm like, what is that, and how cool is that, and who are these people? You can see here the Bureau has 9 of them, and you know, basically, Brett can talk to you a little bit about you know, Bureau of Quality and his role at the time of Pulse, but they were a group of agents, analysts, FBI employees who identify with the LGBT group. And I will tell you that they came in, and when I met Brett, I said, oh, Brett, this is great. We would brief. I asked Brett, you need to brief all the agencies at the Family Assistance Center. We need to know appropriate language to use. We want to be welcoming. We want everybody to be singing off the same sheet of music. And it was amazing. Brett's team went out with us to the hospitals. They met with victims with us. They were at the Family Assistance Center. They companioned with us. They were great. And, you know, I often talk about, when I think about some of the most comprehensive responses that we've done, I will tell you that this community benefited from this Directors Advisory Committee. So this is just a snapshot of all the 9 advisory committees that we currently have. And Brett can certainly give you more details about that in his section. So what I'd like to do is ask, are there, Jim and Betsy, are there any questions in here that have come up through the presentation so far?
I just wanted, this is Jeff. I just wanted to mention that today is the 3rd commemoration of the Tree of Life attack. So. Oh,
geez.
Yeah. So, and we were fortunate enough, they gave a presentation yesterday. So anybody who is on this and didn't get a chance to see yesterday's, you will be able to view the recording later. So I encourage you to do that.
That's great. Thank you for that.
Yeah, thanks, Jeff. Yeah, I'm not seeing anything right now, Stacey. No questions.
Okay. Great. And did we get Brett up? Is he in and ready?
I'm here.
Yay, great. All right. So I'm now going to turn it over to Brett, and he can take it from here and show you and explain to you what his team did and kind of how all this foundation played into what we did in Pulse. So you got it, Brett.
Well, let's hope that my camera works, hopefully, and you should stay on here, Stacey.
I'm not going anywhere.
Good morning, everybody. My name is Brett Kalina, and I am a special agent with the FBI. You've heard a little bit from Stacey about how we generally got involved in Pulse, but I want to talk a little bit, you know, leading up to Pulse. As a, you know, what we called Bureau of Quality was the name of our basically employee resource group. It was a small group of individuals that were elected to a position to represent a part of the FBI regionally. And then our focus was on LGBT queer issues in the FBI and how, you know, day-to-day policies and operations affect LGBT employees. And so, you know, in the course of many years of working with that, you always think about ways in which the FBI can do a better job. And I bet everybody has that in all of their businesses. There's no corporation, there's no government entity that's perfect in all of these diversity groups and how progressive they may be. There's always ways to improve. And so we're always looking at different ways to get information out there on what the organization could do, the Bureau of Quality could do, but also how we could just advance the FBI. And it's interesting because once Pulse happened, nobody ever envisioned our involvement in something like this. You know, we might look at policy language or, you know, just something small in a particular field office, or little things. And then when this happened, it really changed the game, not just for Bureau of Quality, but I think it actually changed the game for most of the different diversity committees within the FBI, because of the success of the response to Pulse. And so when I talk about this, I think about that morning of what June 12th. I had family in town for a college graduation, and the house was packed. And I woke up that morning because of being on the West Coast a little bit later than everybody else. And I had my phone on silent because we had stayed up late and it had just blown up. And that morning you turn on the TV and it was a gut punch like I had never really felt. I mean, I really feel like for me and my family, that really was kind of a 9/11 type moment, in that I won't ever forget it. I won't do that. And the reason is that, as an LGBT person, there are many factors with Pulse that really stood out. One is that in the LGBT community, in the queer community, there are not many safe places. We historically have had safe places for everybody, whether it's church, whether it's the library, whether it's community events. But for the LGBT community, there's really been one historical place where people have felt safe. And that's a nightclub or a bar or a local area where they could go be themselves and feel safe, that they could just be themselves without worrying about what might happen to them. And this really kind of shattered that. And you also had a specific community in Orlando that was there that night. It was Latin night. It was a situation where you had a lot of people in Orlando that went out to that club that night that weren't even US citizens at the time. They came to the United States because they were persecuted or felt persecuted in their own countries for being queer. And here they went to a place where they felt like they were safe in the United States, and then this happened. So you had a lot of individuals that were already very skeptical of that type of safeness, and this happened here. So when I got up that morning, first thing it is, I just called anybody and everybody. I have no power in the FBI. I am really low on the totem pole. Fortunately, I had a couple people as part of the committee that knew us and understood that our worth and what we could maybe bring to this particular event. And so I remember within basically a couple of hours, it was Stacy's assistant director who said, sure, let's do this. Let's bring them in with the team. I don't think there was really a plan. I don't think there was, Stacy talked a lot about planning. This was not planned. And we got there. None of us had ever met anybody else there. And what was great about it is that it was still that welcoming environment. I remember Stacy sitting down with us the very first time. We sat down in a conference room with the group of victims advocates that were there, and they were like, okay, what can you do? What do we need to know? And what can we learn from you guys? And we did the same exact thing. And I remember how open that environment was. I don't think Stacy normally is used to just inviting somebody from the FBI to talk to 250 people at the first Family Assistance Center meeting without knowing what they were going to say. And it really kind of felt like we were winging it at the time. But this also just goes to show that these are the types of things that if you start in advance of this, it really can benefit you down the road. It would have saved a lot of time. It would have saved a lot of energy. It would have relaxed, I think, a lot of people in the room knowing that that element was part of the planning, whereas this was something brand new to Stacy and her team. One of the things that I do want to bring up, just talk a little bit about is like, you know, through my process with working with the victims' assistants in Orlando, there's no, you know, group that probably best is able to be receptive to the information that we had. The victims' assistance specialists that we've met across the country in the FBI and locally in Orlando were extremely receptive to what we had to say. So when we talked about the different aspects that this victim community might have been facing versus other victim communities, they were very receptive to it. But what was interesting about it is that there were a lot of people that were like, I did not know that. I did not understand that. I didn't even contemplate that when I went into this. And so even though all of us are very maybe receptive to inclusion and diversity and equity, that doesn't mean we're experts in all these areas. And what was really great about this is that they allowed us to come in and educate. We certainly didn't come in to, you know, think we were the know-it-alls and knew everything and knew anything. When we got there, we again, were complete fish out of waters. None of us had ever participated in anything like this. But the idea that everyone was receptive was really great. We had really about 4 or 5 main topics that I felt that people that were coming into contact with the victims really should understand about this community in going into meeting with them, meeting with their families, dealing with families overseas. It was quite extensive in that regard. And the main thing was terminology. We had a very diverse community in Orlando that were victims. And this is a marginalized community that is extremely skeptical of law enforcement to begin with. Not only is it because of the LGBT community, it was certainly because some of them were not US citizens. Some of them were people of color that had historically and individually been discriminated against by law enforcement, no doubt. And here we are as the FBI trying to say, please come to us and tell us what you saw. Bring us your device. Bring us, you know, talk to us about what happened there. There were many people in that nightclub that got out. Many got out. And they weren't coming to tell the FBI right away that they were there, because they felt like if they showed up, they would be either mocked or discriminated or not taken seriously. And so it took quite some time for a lot of those people. And so we tried to tell individuals that it's really important to understand the terminology. So if you have someone that presents as non-binary or a transgendered individual that is showing up, you know, we're the FBI, we're saying, okay, let's see your driver's license. What does that driver's license say? And at the time, Florida did not have any avenue for non-binary individuals or transgender individuals that were presenting a certain way that may not reflect that in their actual documents. And us as the FBI, we're just used to getting that information from somebody and being very formal, yes, sir, yes, ma'am, when there's other ways that we can approach that. And I think we talked a lot about that in the terminology, and we tried to give as much information as far as the terminology as we could. But the most important factor that we said was, if you don't know, it is perfectly fine to just ask. Ask the victim, ask the family member, ask the chosen family that was showing up, how would you like to be addressed? How would you like me to address you? And that made a world of a difference, because those people felt like, yeah, maybe they don't know, but they're receptive and they're inclusive and they want to be. And so they're going to make their best effort. And I think that really made a difference, especially for individuals that were showing up at the community center, maybe a little bit later. You had individuals that were, I remember the very first day, there was not very many people that came to the Family Assistance Center. And we were, wondering where that was coming. And we tried to spend a lot of time with people. We tried to go out to the community to talk to the community, make sure that the LGBT Center was aware that the Family Assistance Center was available. And we talked to various other organizations, community service organizations, that the same thing. We want to make sure that this is available. And we constantly heard, well, why would they come there if they're not going to get treated well? Why not come to the LGBT Center instead? And it took a lot of time to really open that up. Once they came, once they saw how receptive the victims assistance specialists were, the word got out really fast, and it spread amongst that community. And I know that community was talking to each other in those days following the event. And I think that made a big difference. I think it was, I don't remember the day. It was probably the 8th or 9th day of the Family Assistance Center. And there was one of the individuals who was one of the performers, one of the drag queens at the bar that night. They had climbed out a window in the back by where they had their dressing room was, and was able to get out, and had some information, was able to provide additional information that we didn't have. Another witness. That individual came and said, I only came because I heard from other people that this was a welcoming environment. They presented as non-binary. Their driver's license didn't match how they presented, and they were worried that they were going to have somebody either mocking them or treating them bad at the Family Assistance Center. And that was really hard to listen to. As someone who's a special agent, and I go out and I talk to people all the time, it really hurts to see that there are people afraid to talk to me because of that historical discrimination that they have faced. One of the other big factors was coming out. Coming out is and here we are, like a couple weeks from National Coming Out Day. It is a very individualized thing. Some people do it when they're young, some people do it when they're old, but the most important thing of coming out is you do it on your time, not on someone else's time. And that is the hardest part. There were so many individuals that were victims at Pulse. Not just, there was a lot of deceased individuals, but there was also a lot of victims, people that had been shot that had not come out to their families. And they didn't get that opportunity to do it on their time the way they wanted to. And I'll tell you a quick story. We had this one individual who had been shot in the arm, shot in the leg. The first time they showed up at the center, they were in a wheelchair. And they came by themselves the first time with their mother. And we sat down with that individual just to talk to them. I remember he had a bright pink cast on his arm, and the mother was not at all worried about the kid being shot, was not at all concerned. I'm sure she was, but that's not how she presented. Her issue was that her son was gay, and she could not get past it. She could not get past the idea that he was going to go to hell, that how am I going to tell the family what happened? How am I, how's this going to affect me and my family? And this poor young man wanted to have us talk to their mom and say, look, look at you guys. You guys are special agents. You guys are intelligence analysts. You guys are employees of the FBI. I have my life ahead of me. I can do whatever I want in this type of way, but their mom couldn't get past that. And I thought how hard that must be to be trying to recover from injuries, as devastating as they were in some instances, and yet that stress of having to come out just was added to all of that. And one more story about the hospital and in coming out is that we not only had people that had to come out as LGBT. We went to one of the hospital rooms and went into the room as a huge Puerto Rican family in the hospital room. Barely fit in the room. They were very boisterous. It seemed to be a very supportive family for the individual. And I walked into the room, and most of the times people would just open up to me when I tell them who I was and what I was there for. This person would not open up, just completely quiet. And the individual, we stayed there for a few minutes. We realized it seemed to be uncomfortable for whatever reason. This person was uncomfortable. And we left the room, and an individual from that room came running out. Probably a partner, a boyfriend of the individual that was there. And he said, "Can you come back when nobody else is here?" And so we said, of course we can come back. We went back after the family had been asked to leave the room, and it was just a few of us. The individual not only had to come out to his family, but he was HIV positive. So he was sitting in this hospital room with nurses and doctors going in and out discussing his care. And he was so stressed that not only was he forced to come out, but that some doctor or nurse or the FBI would somehow release his HIV status to his family and have to deal with that as well. And so he was just a shell of himself while trying to recover through all of this. It really stood out because these individuals faced a lot of issues that most communities didn't have to face. So you had the impact of what had happened to them, and then deal with all of these things. Stacey already talked a little bit about chosen family. It was really important, and I'm again so very thankful for those victim assistance and the Family Assistance Center. When we talked about chosen family, the FBI is we're a very regimented, strict organization, and we don't like to bend the rules. We don't like to change rules. We just don't like to change. And the fact that we said, look, there are individuals here that have been disowned by their family. They don't have a traditional family. They have chosen family because their people have decided, their regular families have decided to disown them. I know, Stacey, we talked about this. There was a couple families that at first didn't even want to accept their sons' bodies back home because they found out they were gay. So, the Family Assistance Center was, not set up. The FBI is not set up to say, okay, well, this person is this is my family that's with me, and I want them to come in and participate in this process with me. And they were able to make the changes and allow to get these people into the Family Assistance Center with them that aided them to feel more comfortable, to really open up, to be able to talk to our agents, to give them information about the case, and that was really important. And then the last issue that we really talked about was that the individuals from the Latin night, and it certainly wasn't everybody in the room, but it certainly was a prevalent factor, was the religious concerns. These people came from strict Catholic families, and there were, although there's religious concerns everywhere, these individuals faced, I think, a little bit more than normal, in that these strict Catholic families just thought their sons and daughters were going to hell because they were in that club that night. Again, I bring this up. There was a couple times where there was discussions about whether or not a family would accept the remains back in Colombia and Venezuela and some of these countries that these individuals were from because of the strict religious concerns. And so I want to make sure we leave enough time for questions, but through this process, I think what's really most important that we learned in this is, one, that the FBI didn't do a good job of this before. We've used this as an example. I have now talked about Pulse a lot. It's a really odd thing. I really love to talk about Pulse in this response with Stacy here, because when people think about Pulse, they think about what happened in the facts and the response, and we weren't part of that. That wasn't part of our job roles. Our job roles was just to advise the victims' assistants and the individuals that were at the Family Assistance Center, which was completely different than the FBI had ever done before. We don't advise all the time. We come in and we do things and we follow protocol and procedures and policies, and that's what we do. But I think what we really learned from this is that we have these individuals, we have these community service organizations, we have these employee resource groups that are there and want to help you. They want to be part of the process. They want to be part of the planning. And it really is important to reach out to some of those individuals in advance of this type of thing happening. Just, let's hope it never happens again. However, who knows? And if you have those contacts, you have those relationships with individuals, you may never need that, but I can tell you that would have really benefited. And Stacy knows this, if now that we know each other, I would envision that if something like this were ever to happen again, she knows exactly where to go and who to reach out to, who to contact, and how to, get this process started from the beginning rather than us just winging it when we were there. And again, FBI is not always the best at just winging it. We're a little bit different in that regard. I know we're at 7:02. I think we have about 15 minutes left, Stacy. We wanted to make sure that we saved enough time to talk about things. I could talk about stories from that for all day. And the resiliency and the fight of the individuals to recover and get back was only matched really by the community that surrounded them. Orlando is very unique in that it really is a bubble. Orlando, it was progressive. That city really came together and really backed the community. But there aren't a lot of places that probably could do that the way that Orlando did. It really was remarkable. But I know that a lot of you in your communities may not have that same backing of the community. And so whether it's individuals for, diversity, different type of marginalized communities, people of color, religious minorities, people with disabilities, all of those different areas are experts that you can reach out to. And I would just, stress that is really something that you could do at the front end to really make your life easier if something were to happen down the road. Anything to add, Stacy?
I could talk about this case forever because there's so many nuances. And as you're talking, I'm thinking about some of the things and not only just knowing, like when we talk about biological family versus chosen family, one example that resonated with me, because I didn't think about this, victim advocates, we do the right thing. And so, know what the laws are in Pennsylvania, like who is considered like legal next of kin, because that means things. And I will tell you, in Florida, it meant things. We returned personal effects, a very expensive watch to a gentleman whose husband was killed. And it was the right thing to do. The agent on our team was like, he bought the watch for him on their anniversary. He wants the watch. He's getting the watch. I'm like, okay, you're the agent. You go ahead. Mom came back and wanted to sue the FBI because she was recognized as the lead. That's the kind of stuff we're dealing with here. And so, and I will say that, Brett's very polite. I don't have tolerance for that. So I really have to fix my face some of the times, because you're going to tell somebody who lost the love of their life, they can't have this personal effect that means so much to him. And the agent that I work with did the right thing. Then we had to get our legal involved. How's, next of kin defined in Florida. Thankfully, this gentleman had the receipt of the watch that he purchased, so he was the rightful owner. But I never even gave it a thought that, geez, when we go into different states, we really have to, we have defense counsel, we have counsel in every one of our offices, general counsel, and hey, how's the next of kin defined? Like, death notifications doesn't really matter because we're not in violation of anything. But when you start to give back property that's sentimental for people, that means something. And this mother who never embraced her son's life, his partner, husband, nothing. Now at the end, she wants to come at us because we did the right thing. That's the kind of stuff we're dealing with. So after a couple of days of responding, patience does not work very well. But this was a great example of how to partner. And as Brett said, if you don't know in your local community who those folks are, learn who they are. Learn if there's a larger major city near you to bring them to the table. They should be at the table when you're developing your victim assistance plan. A lot of medical examiner or coroner's office have those leaders in those different communities that they actually go to. So that might be a start. But I think this is a great example of, what we learned, like what we didn't have, as Brett, you very nicely point out. Yeah, we have all this planning that we said, but you know what? We never even thought about these these directors advisory groups, because why would we? And when we heard that Brett's group was coming, I was like, okay, what are they going to do? But I'll tell you what, lockstep, little things like, as Brett said, people would come to us and say to our victim specialist, you can be gay and be in the FBI. And we're like, yeah, we and we have everybody in the FBI. And so we're welcoming, but people don't see us as that. And we have, a long road to hoe here, but saying that, any way that we could try to show that and demonstrate that. So when we did, and we had in the first anniversary, the Tampa division, who had oversight over this case, wanted to bring the
I think we may have lost Stacy here.
Yeah, it looks like we lost Stacy. So just you, Brett.
It's just me. All right. Well,
Betsy, do we have any questions?
We don't. And I was actually just about to say, Jeff, if anybody has any questions, now would be a good time to put some in the Q&A here for Brett to answer, as we are getting close to the end of the workshop anyways.
correct.
Hey, love.
Oops, sorry.
Okay, I'm still not seeing any questions coming through here. I'm not sure. Let me see if I can get Stacy. I'm trying here.
She's not even back in the session, it looks like. So,
is there anything else you'd like to say, Brett, here with these last few minutes that we have?
No, I again, I think I could talk about Pulse and the response and my heroes, my new heroes. I as an agent, we all grew up with heroes, and it wasn't until Pulse when I realized how important our relationship was with our victim advocates. I really saw the tireless dedication that they gave to that, and it really, aided my career as well. So I really, really appreciate and really admire all the things that victims assistants do throughout the country now, and it really gives me a different perspective as well. So I appreciate you guys taking the time to ask. I see one question. Could you talk a little more about the bureau you work with? Wow. So after almost 20 years in the bureau, boy, that would be, we'd have to take a vacation somewhere and just talk for a while about all the stuff with the FBI. I'd always, my email's up there, Stacy's email's up there, always willing to talk to anybody about my experiences or how committees like ours or diversity committees could really benefit your work as well. So please feel free to reach out to me.
Oh, and there is one question here, and I don't know if I missed this earlier, if it just came through, so I apologize if I missed it earlier, but it says, how long does the Family Assistance Center typically remain on site after an incident?
So I'm not, I wish Stacy was here to better answer this.
Sorry, I'm back.
Let's pop back on.
Oh, yay.
My lovely AirPods went out, so sorry. Can you hear me now?
Yes, Stacy,
Yep.
Did you hear that question?
Okay, so I can, I will tell you that it varies. Different. The scope of the number of victims really drives this, and the community resources. So I will tell you, it is a real. It tasks the community. If you think about it, we are asking communities to send people and have a representative there for maybe 14 days. Then your agencies still have to function. That has been a real challenge. And so saying that, it really depends. So Pulse, we were open, I want to say like 9-10 days. And then there was a transition to the Resiliency Center. We had OVC come in, their mass casualty consultants came in, and they were able to plug into the group that we were working with. Vegas, we were open for a solid 14 days. We had a 2-week, actually it was longer than that. I apologize. It was probably 3 weeks. Now I will say that the irony in this is that the Pulse, most of the victims were from that community. But as Brett said, a lot of them came from South Central America. So, we needed time for people to fly in and do those kind of things and then take care of their loved ones' affairs. We had injured victims who wanted to be medically evacuated back to their home country because that's where their families were. In Vegas, 20% of the victims were from Vegas. So 80% were outside of Vegas. So that made a really big difference. So you really have to listen to your community. But I would say on an average, it's about 7 to 10 days. Unfortunately, you kind of want to know how long you're going to keep open because you want to have your media know that in advance so people will know. And as Brett said, people weren't coming out of the woodwork to come to our Family Assistance Center and Pulse. And I'll never forget, again, lesson learned. We had a lot of people that were coming in from other countries to come back and then go home with their loved ones' remains. We have emergency funds that we can coordinate all that. It's FOCA dollars. We have a whole process to go through, but we were coordinating that. But saying that, we needed people to get visas. Well, so we called on our ICE partners. Now, I would do something different today than I did back then, but I was like, ICE needs to be here. And the reason we wanted ICE at the Family Assistance Center was so that we could go right over to them saying, this family's coming in, we need a visa, can you help us? Well, guess what? The word got out. ICE is here, they're deporting everybody from the Family Assistance Center. And we're like, oh, Lord. So we told ICE, can we just call you and not have you here? But it's those kind of things that we were working with. So depending on what the nuances are, to do all the autopsies for that many victims in Pulse and being able to turn it around, and people wanted to know, when can I bury my loved one? That was a really big deal. And so So again, generally 7 to 10 days, but it really does depend on the scope of your victims, how many victims you have in this case. So any other questions?
Okay, I don't see any other questions coming through. And it is about our wrap-up time.
Right.
I just want to thank both presenters very much for being here and sharing all their knowledge and experience. This has really been a great presentation, very interesting. I want to thank you both a lot. Jeff, I don't know if you had anything else to say, or Stacy or Brett.
Well, there is one more question. It says, Stacy, your position is a huge goal of mine. What was your career path like leading up to you working for the FBI Victim Services Division?
I have a lot of experience, to the point where somebody in my family once said, can you keep a job? I'm like, that's not funny. I've always worked in victim services. So I started out, as I said, as a volunteer at a rape crisis center in college, then did my internship at Crime Victims Council, the Lehigh Valley, which a lot of you guys know are in the northeast part of Pennsylvania. Worked at a rape crisis center, but I also did prosecution-based. I then left and went to Florida and lived in South Florida for a number of years at a child advocacy center. I also worked for OVA and the Pennsylvania Board of Probation Parole, and then came to the FBI. So I have all experience in victim services, but I have it in a lot of different areas. So if you're interested in a position in the FBI, reach out to me. You have to have 3 years. You have to have a social science degree. You have to have a minimum of 3 years working with crime victims directly. And so we are hiring. We're hiring. So feel free to reach out, and I'm happy to talk with you about some more details.
Okay, well, thanks everyone so much.
That looks like all I have.
Okay.
Thank
so
you.
much.
Thank you. Huge thanks to Brett, because he's on the West Coast, and I appreciate that he got up and he came out and he did this morning. And thank you so much, Brett. I really appreciate it.
Thank you all.
Thank you both very much. We appreciate you being here today.
Thank you.
Thanks. Bye-bye.
Bye.
Okay, Betsy, you can stop the broadcast.
Okie doke.